This is a suprasternal notch cardiac ultrasound. This is something that we don't always do. And I wanted to make this video to illustrate how this can be helpful. What you do is you take the phased array probe and you find the sternal notch right below the thyroid. And there you put a lot of gel because it's an area that can be kind of discomforting. And you try to look at the aortic arch to see if there's a dissection, if there's an aneurysm. In the case of this patient, there turned out to be an aneurysm. You can see here, if I pause it, this whole thing here is a type A aortic aneurysm that you wouldn't be able to see on normal cardiac ultrasound because this is at the apex of the aortic arch. This is just a simple YouTube video that I think better illustrates what I'm talking about. You take your phased array probe, you put it in the suprasternal notch space, and that way you're able to get a view of the suprasternal area that helps take a look at the aortic arch. And so again, by doing that in this case, we were able to see this very large aortic aneurysm in the ascending aorta, which is something that you don't normally see with ultrasound. And this modality is something that is not always done. But as you can see in this case, it can be helpful in the right clinical setting if you are concerned about an aortic dissection or aortic aneurysm in the ascending aorta, which is more difficult to see.